Hi, I'm Millie. I'm autistic and ADHD. This is my channel where I make videos about my experience of being neurodivergent. This is a special one. I was just recently invited to be on a panel of the Opioid Use in Primary Care Conference 2024 that just happened recently. And there I answered some questions based on my lived experience of drug use and accessing care for my addictions issues. And that all kind of is related and stems to trauma. I've related to being autistic and ADHD and transgender and that kind of things. So yeah, the following videos are me answering those questions for the panel. So originally somebody else asked the questions, the person hosting the panel, and then I answered them pre-recorded video, and I had pre-recorded them as an accessibility thing, so as an accessibility request, which was very nice of them to help me with that, because otherwise I wouldn't have been able to take part in the panel. So anyways, they asked a question, and I had the pre-recorded answer. So in this version, I'll just ask the question to myself, and then my answer will follow. Tell us a little about yourself. So a little bit more about me. I'm autistic, ADHD, and I'm also transgender. I've also been using drugs for over 2 decades at this point. And I've used basically all kinds of drugs, but my drug of choice eventually became opiates and opioids, specifically heroin and oxycodone. Drugs became essentially like medicine for me because of physical pain, but also mainly from ongoing complex psychological trauma related to being, for a long time, undiagnosed autistic ADHD, also being transgender. So in a complicated world not designed me, where I'm often judged and looked down upon, again, marginalized just for who I am, how I was born. I've also been spent over 10 years in various kinds of treatment for opioid use disorder. So on and off treatment, but I've tried pretty much everything there is to try. So like for OAT, tried methadone, Suboxone, and I've also had safer supply. So slow release oral morphine, Cadian, oxycodone, and tried fentanyl patches as well. And yeah, quite a few years experience with some of those already. I've worked over the last few years in harm reduction at supervised consumption sites, as well as safer supply clinic. And I've been part of many focus groups, committees, consulting, research projects, and I'm also just trying to do my best to be a disability self-advocate when I can, when I have the energy and when my health allows. Could you please speak on how opioid use treatment is ableist in nature and how this can create barriers for people who are neurodivergent? So yeah, I've experienced and seen a lot of ableism when accessing treatment for opioid use disorder. This is a lot in specialized clinics, and so places with harm reduction at the focus. So really, it's like places that should know better, but it seems to be something that's just often forgot about, and I end up not being able to access clinics, access my medication, access appointments, end up being unable to access pharmacies to get my meds, or I'm just forced to because, what's worse, consequences, being sick because I don't have my meds, or being sick and distressed because of what being in those spaces, like the physical issues of the spaces and socially how I'm treated, like I feel like I don't have much of a choice sometimes. So then I just have to go in, and it can cause me shutdowns and meltdowns, and sometimes even trauma, or dealing with complex trauma most of the time. So I don't want to, a place where like I'm supposed to feel safe, adding to that trauma, right? So as I mentioned before, some of my diagnoses are autism and ADHD and PTSD, among other things. So I have other physical and mental health conditions. And for me, that makes me disabled. And these things inherently cause a lot of challenges, but there's a lot of parts of that, like people talk about social model of disability, where, some of the things are within me, some of the things are things I can control or minimize, like to some degree, but really a lot of the issues they're having are stuff that are under control of the people working there: doctors, nurses, harm reduction workers, social workers, like the people working in these spaces and designing and building these spaces as well. That could be minimized by offering accommodations, but also learning to be empathetic towards me as what it is to be an autistic person. Like, to me, that's not a bad thing. It's a misunderstood thing. And so some barriers of being neurodivergent, and again, neurodivergent is things like autism, ADHD, dyslexia, and there's other things that are under that umbrella. So some of those barriers are being misunderstood and judged socially, kind of like I've talked about before. So basically not being liked and trusted for how I was born, essentially, right? There's this thing fairly new in psychology called the double empathy problem. I really encourage people watching this to go look that up, the double empathy problem. And the basics there is that what they found is that, it's thought that I'm like, as an autistic person, the misconception is that we lack empathy, but that's not true at all. What it is that I have a harder time empathizing. Like, they found autistic people generally have a harder time empathizing with non-autistic people, and then non-autistic people have a harder time empathizing with autistic people. But autistic people empathize perfectly fine with other autistic people, like I do. I feel that. And of course, non-autistic people empathize really well with other non-autistic people. You have to think of it like a cultural thing, like somebody from Finland or Japan. There's things I relate to there, like parts of their culture. Like in Finland, people don't small talk as much. It's what I've learned. So like, avoid small talk. And so to me, that's like part of being autistic. So yeah, this is a cultural issue. But anyways, there's that misunderstanding, and it's like our way is the wrong way. So this is something that people need to understand. It's like, I come to you, I'm in your world, I try to understand you, and I just want you a little bit to come into my world and understand me, like at least meet me halfway kind of thing. And some of these studies showed that non-autistic people judge autistic people as being unlikable and untrustworthy within seconds or minutes of just seeing us, without having even done anything. So like this innate sense. And so that's already like what I'm working against going in anywhere, right? Going into these services. And, that's just one thing. For me personally, like I deal with situational mutism. So even though I'm speaking now in situations with new people or high stress, which is often like a medical care situation, I have difficulty speaking. So that becomes an issue. So I speak like with an AAC device, text to speech. So people need to understand that. Environmental, I have special issues with certain kinds of noise, background noise. Then I have trouble processing speech. So that'd be an issue, like getting the medical information. I have an issue with bright lights, especially overhead lights. Some autistic people can have, it's like all kinds of sensory issues. So with scents, smells. A big one is myself, and I think a lot of autistic people have difficulty speaking on the phone. So this is a huge barrier in medical care because it's always like, no, you need to call us on the phone. Even if I say I have a difficulty, if I say I have a disability, like a lot of the time it's just like, no, you're being difficult. I've even been hung up on. People get exasperated, like just for these simple things. Like I'm just trying to ask if I can email a question or book an appointment with an online system. Some of my difficulties are understanding instructions if they're not clear, and then executive functioning, so planning, prioritizing, remembering. So yeah, I need help. So that causes difficulty with like appointments, when to have appointments, all this stuff they need for to get care in these kind of clinics. So some simple accommodations then can be like to be able to people to book appointments online, to be able to message online, have the option for video and telehealth care, like as an option. Sometimes it feels more important and I want to come in, but it's great to have that option for days when I just can't go out of the house. And again, making sure instructions are clear, having different options for lighting, being able to dim lights, that kind of thing. Being able to have quiet spaces if things are overwhelming. And then the social things, like I was saying that before, like not, if I'm being direct or asking direct questions, it's just because I'm trying to understand what's going on and I'm not being rude. So like for people to understand and empathize with my side and not see me as rude and not shut me out and not treat me badly as a patient. Like they shouldn't be judging me that way anyways, but people are human and unfortunately they do. And I've experienced that a lot. And, not doing things like not demanding eye contact or judging people if they don't make eye contact or are fidgeting, and don't think that somebody is being evasive for those reasons. Like they might just be autistic or ADHD or those kind of things. So it's not just an issue of making accommodations either. It's an issue of cultural safety and cultural humility. So being autistic, I have my own distinct culture shared with other autistic and neurodivergent people. So a lot of the principles of cultural safety and humility that are being taught, like it's something you might have learned if you're watching this. A lot of people are taught working in this field. And these same principles can be applied to autistic and other neurodivergent culture, and the end goal being a neurodivergent affirming services. So please seek out training. It's becoming more and more available, like how to have neuroaffirming care, basically, and cultural safety and cultural humility for neurodivergent people, autistic people, that kind of thing. I think the people working in opioid use care are generally good people with good intentions. So this ableism, I feel, is coming from a place of ignorance and not malice, and that's why I'm wanting to be a part of this and share my experience today. The ableism is causing a lot of unnecessary harm to people with disabilities like myself, and working and volunteering in this field for quite a few years now, as I said. Often when planning meetings and projects and committees and research are happening, and people are talking about marginalized minority groups accessing these specialized services. I find like disability is not even mentioned. Like it's not even, it is forgot about completely. So please, like if you're having those kind of things, that should be something you're talking about. And the reason this is so important, of course, it's important to me. It's hugely affected me accessing care. But generally, like being autistic makes me more likely to have a substance use issue. ADHD, even much more so. And then there isn't enough research on this, but I imagine the combination then of autism and ADHD makes me that much more, even more likely to have substance use disorder. And so therefore, and then in my experience, a lot of these clinics have a lot of autistic and ADHD and other neurodivergent patients. And yeah, so that then us being a core demographic in this type of treatment makes it extremely important to recognize this ableism and try to work to stop it and offers better, safer service, because further trauma is being caused so unnecessarily to people like me who are already there getting addictions treatment because of trauma. What are the differences you experience when accessing opioid medications for pain management versus that of opioid use disorder treatment? So yeah, as I mentioned previously, I have lots of experience with opioids and a lot of experience in opioid use disorder treatment, but also because of being transgender and because of other health issues, I've had quite a few surgeries and those things, especially in the last 10, 15 years. And so I've had prescriptions for both reasons, but for the same medications. So I've kind of seen both sides of things and how I can be treated. And I find it very strange, like just being, the same person, but going in, like, let's say to the pharmacy, for different reasons, whether I have a prescription for surgery or whether it's from an opioid specific clinic for OUD. So I've experienced a lot of differences when picking up meds, whether they're prescribed for OUD or for pain. So let's say at the pharmacy, with OUD prescriptions, if I've been to a specialized pharmacy that I'm the kind of person like coming in treatment for addiction, then it's been a lot more understanding. But there are then a lot of specialized rules as well. But kind of talking more now about going to like a national pharmacy chain, because that's where I ended up going a lot of time, because I was living in a place where that would be the closest place to go to, the most accessible, and I don't drive and that kind of thing. So I just noticed, you just get treated differently. Like I would be forced into signing like behavior and conduct agreements at these pharmacies, that kind of thing. So something other people don't have to do. And when I was getting a prescription for pain, like for surgical recovery or something, then, I wouldn't have to sign an agreement like that. I could just pick it up like another medication. There'd be just the regular narcotics restrictions, But I've literally had that at the same pharmacy where if I'm coming in for opioid use disorder, like I'm in the same person at the same pharmacy, but if it's for OUD, I have to stand at a different window. And then if other people are there, like I think a lot of people know if they're regularly picking up prescriptions that if you're standing over there, you know, you're the person getting methadone or other things. Like they're like, stand over there, not with the other people coming in. So that feels like a different, like you're a different class of person, you're being singled out, kind of having to sign these kind of agreements that are very strict about when you're going to be picking up, if you're going to be late, if there's going to be consequences, like how you behave when you show up, if you're intoxicated, that kind of thing. And then, yeah, so after surgeries, just been able to go to the regular window, pick up the medications, and it's also just, how I'm treated. Like, so at the pharmacy, I've had, some of the pharmacists be nice, but at some pharmacies, I'm just treated like I'm a shitty subhuman person, like somebody you can just treat bad before I've even done anything, like they're already being short with me and impatient before I've even said anything, like they don't want to deal with me. Or I've had where the people serving me, like they don't even want to really look at me. I get that feeling. And then I've come in after the surgery and stuff, and it was all friendly and fine, just like would be for anybody else, And I've had these surgeries while also on the getting the addictions treatment. So yeah, it just seems especially strange then, the comparison. And and then different treatments too, like when I was going for surgery, but I had the opioid use disorder prescriptions, I had OAT, I think once when I was doing surgery, and I had safer supply, and I'd known for the surgeon for a while. And when I'd first met my surgeon for the first surgery, I was during a time where I didn't need any treatment at that time. And then later on, like a few years, I'd gone through a really rough time, and then I was back, had prescriptions again, and it was really helping and everything. But yeah, when I had to list all the medications before the surgery, then I could just tell my surgeon's mood just really shifted, and I just felt like I'd done something wrong or disappointed them or something. So, that kind of thing feels bad. And then the different rules like having while I'm going to clinics and that kind of thing, of course, like having to do P tests and that kind of thing, semi-invasive, kind of embarrassing things like that. It doesn't feel fair when other people are not having to do those things, who are just getting a prescription for pain management, that kind of thing. So yeah, those are the differences I've experienced. If opioid use disorder treatment were to shift more towards treatment in primary care rather than specialized clinics, what would you envision this looking like? How would this be beneficial or harmful to you? I can see a good and bad side to OUD care in primary care rather than specialized clinics. Like I've experienced both. I would like I think more options are always great. Like I want to see more of both. Like the benefits to having it available in primary care. Hopefully, like if there's a lot of primary care physicians offering this service, then hopefully that would mean that people could go to a clinic that's closer to them, making it more accessible, go to a place where it's not so overwhelming. like maybe a place where they feel safer. Maybe if it's a doctor that they've already had for a while, it's like somebody that knows them well, so can hopefully give them better treatment. And, hopefully I've always lived in cities really, but for people living rural and remote areas, I could see that giving people more options, not having to travel as far as well. And the other side of it, in specialized places, like, even though, like I was saying before, like a lot of the accessibility stuff and ableism needs to be worked on, but there at least is this built-in a lot more knowledge about like why have trauma, trauma-informed care, and being just less judgmental or non-judgmental in the first place about using drugs, and being understanding about the ups and downs and treatments, or not showing up for appointments, and the barriers and what can get in the way. So that part can be really good about specialized care, or places that are bigger service and can connect you more easily to other services. That really helps. And places that can have a lot of people on staff, hopefully, that have lived experience, that kind of thing. But yeah, really, hopefully, it can be in both, like have both available, like just more of it everywhere, more, better. So if somebody feels safer, and like it would be better to go to the primary care physician, then they have that option. And if going to a specialized clinic they find would be better, they have that option too. Like just people being able to choose. That's what I want. Thanks for watching these videos from the Opioid Use in Primary Care Conference. And thank you to the conference organizers for having me there. And just thanks for watching this and learning about my experience of being neurodivergent and how that's impacted my life. And please check out the other videos on my channel for more about my experience of autism and ADHD. Thanks. Bye.